I'm Ashley Wagasback, feeding therapist, occupational therapist, and lactation consultant. Look forward to discussing all things feeding so that we can support you to bring your little one to their maximum potential so that feeding can be enjoyable for the entire family.
Are you looking for a community of other moms joining together to support their little one through the ups and downs of feeding and gross motor milestones? The Thriving Together community is just for you. Find us on social media at Instagram, Facebook, and www.sensorysolutionsTherapy.com to learn more. We look forward to seeing you. Hi, everyone. Welcome back to another episode of the Feeding Solutions podcast. Today, my guest is someone who's recently come into my world, Dr. Allison Hamada. She is an orthodontist who is in the Louisiana, New Orleans area. She has been practicing private practice orthodontics for over 20 years and a native of Louisiana. She graduated from LSU School of Dentistry and completed her orthodontics training at Columbia University. After practicing traditional orthodontics for about 15 years, she furthered her training under Dr. Tom Pitts, and she has become a master of the Pitts 21 bracket. She's presented her cases alongside Dr. Pitts internationally for over several years now. And Dr. Hamada's practice was originally has evolved into a boutique style practice with a focus on custom stunning smiles paired with ideal airway foundations. She believes in giving patients the time and attention deserved to thoroughly evaluate their specific orthodontic and airway needs. This is so exciting. She's developed customized treatment plans based on the latest research that she feels will provide the best long-term outcomes for families, not only with an aesthetic smile, but also their health. Some refer to her philosophy as functional orthodontics. I'm eager to talk about that. But she thinks of what she does as her way of truly serving and caring for her patients in the best way possible. Dr. Hamada believes that the only way to advance airway healthcare is with an interdisciplinary approach. She leads a local multidisciplinary study club that includes pediatric dentistry, general dentistry, myofunctional therapy, physical therapy, and ENT's pediatrics. And she's an active member of the international recognized multidisciplinary Airway Circle group. Fueled by her personal airway story as a mom, her mission is to bring awareness to and to put a notable dent in the airway epidemic in the greater New Orleans area and beyond. And with me in your world now is definitely beyond.
I love it.
Welcome. So
Thank you,
excited to have
Ashley.
you here.
This
Yes,
is
yes.
so exciting. I'm so happy to be here with you and your group.
Yes, yes. Well, I just feel like you were put into my world as like providential because I was not looking for, I mean, I guess I was, but Autumn Henning was the one that actually, she brought up your name and I'm like, goodness, Autumn trains thousands of people a year and our little consult, she happens to bring your name up and I'm just like, it's so wonderful. So
Crazy.
I know. So welcome, welcome, welcome. So
Well,
before
thank
we get
you.
started, just kind of give us a little bit of background about you and your training and
Yeah.
kind of like how you are practicing today.
Yeah. So I entered the world of orthodontics like everybody else, trained in a traditional United States orthodontic program. We were exposed to a bunch of different types of methods and philosophies, and we got to choose which one we were going to use in private practice and then practice it. And so I did that for, 15 years. And I kind of just got a little tired of the results and the fact that the patients weren't, they were happy with their smiles, but they weren't like loving them. And they just really wanted to get their braces off.
Mm.
And I just kind of got turned off by that. So I really kind of began the hunt for high-end aesthetic results. Like, what are we missing? Because what we were trained doesn't really address aesthetics that much, believe it or not. It's crazy.
Same.
It's more about the occlusion and the bite and the way that the jaws relate to each other. That's what we're trained to do. And so anyway, by the grace of God, I found Dr. Tom Pitts, who is just, when the student is ready, the teacher will appear. And he took me under his wing, and he is a Trojan of an orthodontist. He's well into his 80s, and he's blowing and going, teaching the world.
Wow.
His very high-end, high aesthetically reaching orthodontic system. And we just clicked, and I absorbed everything and worked with his system for years. And what makes the system different is that the forces are light. So with very light forces, you can make the bone wider. So you get wider smiles. And it's more comfortable. So wider smiles are prettier smiles. But with the lighter forces, I began to notice that I was kind of being pushed around a lot by the surrounding musculature. And I didn't understand that. It took a long time to go, oh, it's the tongue. So then I thought everybody is tongue-tied, and there was all this dysfunction. So I learned about myofunctional therapy and met some wonderful myofunctional therapists, including Autumn Henning, who completely opened my eyes to this new world that I had never heard of before, and dove into that. But that sort of led me into the domain of sleep. And recently I went to the first World Sleep Congress, and the information presented was largely over my head, but I got the message. This is about airway. This is not about tongue ties so much. I mean, it is, but the bigger picture is about creating airway so that we can sleep better, function better, be healthier, grow better, all the many things that come along with that. And then I began to understand the importance of where and how big the jaws are. And that was it. There's no turning back. Once you understand that, you can't go back and practice traditional orthodontics.
Yes. So, okay. So with that new knowledge, it forced you to add more expansion, or like
achieve new, completely different goals. Completely different goals, because I mean, we were trained to do expanders in orthodontic school. And I've used them before. I used them a lot before I switched to the Pitts 21 bracket system. But the problem is that we weren't expanding enough to influence the airway enough and to get upper jaw advancement enough so that the skeleton or the jaws are then in the right place to allow the child or adult to breathe much better and reset. From a nervous system perspective.
Well, and isn't just like evolution, like isn't the human
and
jaw getting smaller?
That's exactly right. And I think that's why this is such a silent problem. It's a silent epidemic that most people are not aware of.
Right.
Because it's been so gradual. We've all lived in a society our whole lives, and so have our parents and even grandparents lived where mass farming has been part of our world. But with reduced breastfeeding and baby food and all the soft diets that we're eating, our jaws are truly shrinking with every generation. And there are skulls to show this that is happening, and what we're living and experiencing with our children and ourselves and our spouses. These are the effects of that change over the years that are, to us, normal. Snoring, it's normal, but it's so not.
Right. Exactly. Yeah. So, okay. So snoring, um, we were talking before we started recording about attention, sleep, bedwetting, that kind of thing. So those are that's part of this epidemic with this airway. So what are some of the strides, that you're seeing with this new approach, or the way that you've adapted your,
Some of the changes we're seeing in patients
yeah.
after, yes. So most parents come to us for crooked teeth. And I see it clear as day now that the jaws are too small. So I
Mm-hmm.
know what to do. And some parents are ready to hear the airway conversation
Mm-hmm.
and embrace it, but some aren't. And that's okay too.
Yeah.
It's a what we're doing is a little bit different. It's a different concept, but once I do the expansion as needed, they begin to notice,
Mm-hmm.
hey, I think my child is sleeping better.
Mm-hmm.
I do notice that, he's a little easier in the morning. It's easier for him to go to sleep and wake up,
Mm-hmm.
and we're not so fidgety anymore and we're not interrupting as much anymore. And wow, you know what? This has made a tremendous change.
Mm-hmm. Mm-hmm.
So that is so fun to me. I've always tried to make the biggest impact on patients that I can, and this is it. I sort of
Well,
feel like I'm put on this earth to do this and help people in this way.
yeah, I was um I was having a conversation with the myofunctional therapist that we work with for my 15-year-old, and we were talking about you and our visit, and she kept saying, you have to go with your gut, Ashley, you have to go with your gut. And I told her, I said, that's when I was butter in your hand, when you notice, and I didn't even bring up the high activity level of one of my kids that was in your office. And you, without me even bringing it up, you said, you see, all of this is going to quiet down. And to be validated, because I've said it so many times to other people, like there just seems to be like a lot of energy. Like it's a big personality, and I'm not trying to like squelch a personality,
Right,
but this just seems a little amped.
right.
And for you to be like, that's gonna quiet down, I was like, this is where I gotta go. This is where I have to be, just to
And
be validated.
absolutely. And we've almost been, as moms, like we're the ones that have to internalize all of that
Hmm.
because, we're the moms. We're the ones who are supposed to make it all right and fix everything and make it all work.
Hmm.
But when something's not right like that, and you're the only one, it seems like,
Yeah.
who's noticing these things and thinking, something's just not right, but nobody is hearing me. It's kind of maddening.
Right.
And I think there's a lot of that in our world today, that our parents are silently suffering
Hmm.
from the effects of this
Hmm.
airway ADHD like presentations,
Hmm.
and nobody can really talk about it other than just get them on medicine.
And some of it's even just more subtle. Like my child is not, it's not impacting function at school, but I'm
Yes.
still like, goodness,
Mhm.
And like I say it all the time. I'm like, I don't know if it was like because I'm an older mom,
Right.
if this is my, one of my later children, if I don't have as much, like you start second guessing everything.
Sure. That's
Fine.
what we do as moms. That's what we do.
Like, is this a me problem? And
Absolutely. I hear it over and over about the breastfeeding things, the
mhm,
breastfeeding difficulties. They end up in our office because the tongue was tied, but nobody really validated that. And
right.
so now the jaws aren't growing right. And mom's like, I knew I was having trouble.
Mhm,
It was so hard and painful, and
right.
it was so much reflux, and it's like, oh my gosh, that's when they're like, this is all related to that.
Yes. Right.
Yes.
Goodness. So good to be here. So as far as like some information that the listeners should consider, like when they're looking into orthodontics, because this was actually one of the conversations I had yesterday, it's it is just more than just like the aesthetics. So how does someone figure this out when their dentist just says your child's ready for orthodontics? It's like, okay, well, what do we need to know?
Great question. You know, taking on something that Dr. Pitt's view of life and of orthodontics, it's like just begin with the end in mind.
Mm-hmm.
And if you take it from that perspective, it's a little easier, maybe. So what are your goals? And if your child is 7 or whatever, try to, imagine he is going to be 18 at one day, and what do you want to be able to have given him?
Mm-hmm.
Do you want him to be sleeping well at night? Do you want him to have the best facial aesthetics? Do you want him to wake up feeling rested? Those are the kinds of things that aren't typically associated with orthodontics, but we can help with that.
Mm-hmm.
We can. And if your dentist is saying you have an orthodontic problem and your child is ready, it usually means there's a bite problem, there's crowding, and all of that has a root cause. It didn't just spontaneously happen.
Mm-hmm.
So traditional orthodontics straightens the teeth, fixes the bite, but a different approach is to get to the root cause,
Mm-hmm.
address that and the surrounding jaw size, and then the teeth are going to get straight, so on their own. So if you're looking for that type of approach, do your due diligence.
Mm-hmm.
Get on social media. There's a ton of information out there. And once your feed sort of gets corrupted, you can't stop it.
Yeah.
But on the other side, there's traditional orthodontics. This type of mindset, really, not everybody is ready to embrace it.
Sure.
And so some people are almost frustrated by it.
Mm-hmm.
And I really have to be very mindful. I don't want to force anything on anyone. I want patients to always have their choice, but I also want to educate.
Absolutely.
So, there's traditional orthodontics out there. I mean, we do it. I find myself doing much, much less of that.
Mm-hmm.
But it is out there. And, we just put braces on and we straighten the teeth and we fix the bites best we can. And that's that. And that's fine.
Mm-hmm.
But there are other objectives that we can accomplish and achieve. And it's exciting to think, to me, about what we might learn 10 years from now that this has impacted in a positive way and for life. Because if you're building a healthy airway at 5, 6, 7 years old, that child is not going to suffer through all the things that children who maybe didn't have access to that might. And that includes, constant, congestion, allergies, and maybe asthma. Not that we can cure all of this, but we can make a big, I think, significant dent.
Right.
And so think of the missed school, the missed work, the psychological struggles of that might go along with focusing for years. I mean, personal experience, we have this. And so to know that we can do something about it, it's just so fun to me.
It is.
And I can't wait for more research to come out, because Stanford Sleep is doing a ton of research I just love what they're doing out there, and it's so exciting. But I feel like the scope is just tremendous. It's tremendous.
It is. Absolutely. Yeah, for sure. So when you have someone come into your office, what's sort of like your approach that you take? So I have a 5-year-old in
Mhm.
comes in, traditional, it's like, oh gosh, that's like way too young for ortho.
Mhm.
But here we are in
Yeah.
expansion. And so what would you say look kind of like an ideal place for a parent to start?
You
Look
start.
like?
First, I would start watching your child,
Mm,
be observant, from like an outsider's perspective. Just try to really take a look at their behavior and their sleeping patterns. Like, is it hard for them to go to sleep? How are they waking up with the covers all over the place?
mhm,
They kind of hard to wake up, irritable. Do they go to the bathroom in the middle of the night? Um, that kind of thing. Just be aware of what the teachers are saying,
mhm,
how they're eating.
mhm.
Um, what else? Just be observant. And then if you feel like, yep, you know what, they're mouth breathing and they're snoring and all those kinds of things, we're seeing patients at 5 on up. So to me, if the earlier that I can see a child with, sleep disordered breathing or mouth breathing, the more positive of an impact we can possibly have.
hmm hmm So
But
do you typically do multiple phases?
right. So to me, in my office, the way I see this sort of happening is kind of the reverse of what's traditional.
Okay,
So to me, the bulk of the work should be accomplished by 9, 10 years old.
okay,
That's the heavy lifting. That's the important stuff. That's the stuff we really, really need to be actively involved with and trying our best to do our best job to grow those jaws while they are still malleable.
okay,
And then the work should be largely done.
okay,
And then traditional age treatment, 12, 11, 12 years old, when all the teeth have erupted, then it's just icing on the cake.
Shift
Aesthetics.
things, yeah,
Yeah. So that's how that's our my sort of goal would be. That would be ideal is for me to see them 5, 6, 7, 8, 9 years old, and then do all the heavy lifting if necessary, and then have the easy stuff later.
okay. So if a parent has a 4 or 5-year-old, is that too, or even a 3-year-old who might be having behavioral issues? I mean, is that too young to come in for a consult with you?
The way I look at it, this is a multidisciplinary
Yeah.
approach. I mean, it's just me in my office,
hmm
but I work with dentists who have myofunctional therapists in their offices.
hmm
And these dentists are very airway aware and they know exactly what's going on.
hmm
And so it's very helpful to collaborate and think of this globally. So, I typically I don't mind evaluating a 30-year-old, but I feel like at that age it may be more important to get to the root cause and deal
Sure.
with, say, tongue dysfunction.
Yeah.
Um, and I think at that age they're so malleable. If you get rid of the root cause that early on, your chances of needing orthodontics are much, much, much less.
Okay.
Mhm.
Okay. Yeah. I
So I'm
mean,
trying to work myself out of a job so I can retire.
love it. Yeah. Well, I mean, and that's what I've heard, like why would, an orthodontist want to work on early expansion to get because they're not going to have all of the ortho
Yeah.
work at the
It's
older age. It's ridiculous, but
yeah, that scarcity mindset kicking in. That's no fun.
it's no, for sure, for sure.
Yeah.
So we've already talked about some of the symptoms. Are there any other fly under the radar symptoms that a parent may blow off that they really should draw attention to, or other signs that would warrant a parent to really take this seriously?
Well, maybe I could take a second to sort of go through my history with one of our daughters.
Perfect.
And what I now see when I look back.
Okay. That would be great.
Because, she's a typical overbite kind of kiddo by the time she's 12. By 7, she was super, super narrow, and I knew I had to expand. And I did what I knew to do at that time in my understanding, which still haunts me. But now when I look back, it's all very clear. So what the flags that I missed, as an infant, she was not a great sleeper. Breastfeeding was very difficult. She had reflux. Tried all the different formulas, all the things,
Mm-hmm.
And she was a mouth breather at birth. And it's interesting because a pediatrician told me this once when I was trying to turn the lights on for them about the importance of releasing tongue ties at birth. And he said, all I know about those babies are that their upper lips are shaped like that. And I was like, you're right. You're right. And so they mouth breathe.
Mm-hmm.
And I think that's the first sign of their upper jaws growing down and backwards.
Mm-hmm.
So this happens early.
Absolutely.
So I missed that. So your baby should not be mouth breathing or drooling a ton, really.
Mm-hmm.
Even with teething, I don't think that should happen.
Mm-hmm.
Yeah.
I talk about that often with families. Definitely. Yeah. If your mouth is closed and you're reflexively swallowing your saliva.
Yes.
Yeah.
What else did we miss? So we missed anxiety. That was in 3rd, 4th grade. We started hearing from the pediatrician about anxiety. And I was like, what am I doing wrong as a parent? Like, how can my 3rd grader have anxiety? Like, what am I doing? Airway.
Yeah.
It's airway. Little bit about wedding we missed. It wasn't a big deal for us, but as we got into the older years, there were some, like, a little bit of reading difficulties that bother her more than her teachers.
Mm-hmm.
That's related, I feel.
Mm-hmm.
Yeah. And baby teeth with no space in between.
Yeah.
So those are sort of the markers that I missed that I wish I had known. Mm-hmm.
Well, and so to expand a bit, just because I was listening to something yesterday that about why anxiety, because I'm sure parents are like, I just don't understand.
Yeah.
And basically, like if your mouth is open whenever you are sleeping, it's your brain's like it's grasping at air. So our mouth is never meant to be open.
That's right.
When we're sleeping, nose is for filtering the air. So our lungs have clean air. And so when the mouth is open, it's your first sign, outward sign that the brain is like in a fight or flight place. And so it makes sense that you're going to see your brain being in a place of fight or flight during your wake hours, anxiety, attention issues, that sort of thing. So
I think you're absolutely right, Ashley. And I think research is coming out now that when mouth breathing it happens, it doesn't take long for the brain to then be sort of rewired into, hey, this is fight or flight. We have a problem. And then that's it. The cascade starts, and then the nervous system is hacked.
It is, because that's when our healing recovery happens at night.
That's right. That deep REM sleep. And if they're not able to go into that deep REM sleep several times during the night, and have full cycles of it, they're never going to get that nervous system reset, the cognitive reset, the immune reset. And the effects of that are the ADHD-like symptoms that we see, and maybe even allergies, all these food allergies. I'm not sure. Who knows what all is related to what this airway problem is really doing.
Yeah. I mean, I was having a conversation this week about the gut brain connection, and we cannot separate this.
No.
Not. So it seems like such a far fetch that if you're breathing with your mouth open at night, that you would have attention difficulties and that somehow your gut would be
I know.
chaotic as well, but it's so
So,
interconnected.
so I don't know if you guys can see this, but I can't talk at consultations without this. Can you see this? Yeah.
Oh, look at mine.
Oh, you got one? Okay, great.
All right.
Perfect. Let's use that one. Okay, so
No, we can use yours. Use yours so you can explain.
okay, so when we expand with traditional braces,
You might need to put it closer because you're back. There we go. You're
okay, when we expand with traditional, oh, it's hard, huh?
yeah.
Yeah,
It's
it's
still
weird.
blurred. Yeah.
The upper jaw widens this way with traditional braces. Okay, when we expand with palatal expanders that separate the two bones of the palate,
Mhm.
is this clear?
Still blurry. Come closer,
Is
maybe.
this there? Oh.
Put it in front
There.
of your chest. Yeah, there we go.
Okay. This is, oh, it's just this narrow little, this area right in the floor of the nose is widened.
Mhm.
Okay, so when the roof of the mouth is expanded, the floor of the nose is also expanded. So when the floor of the nose is expanded, it's easier for the person to nasal breathe without resistance.
Mhm.
And when that happens, the lips are more likely to stay closed and they're going to get deep, restful, restorative sleep. So that's why getting the jaws wide enough is so critical. Um,
Absolutely.
we also know that moving the jaws forward enough is equally as critical. There are oral surgeons now who are trying to get patients off of CPAPs because, as you know, it's this crazy epidemic. Everyone is on a CPAP,
Mhm.
and part of the reason is because our jaws are not, they haven't grown forward enough.
Mhm.
And not only outward, but forward. So these jaw surgeons are moving the jaws forward to allow the tongue more space to get out of the airway.
Mhm.
So when we're treating patients, it's important to also take that aspect into consideration too, to properly build them so that they don't have to have this jaw surgery when they're later if they want to correct their sleep apnea problem.
Yeah. Yeah. Well, and just with that, it comes to mind that a mom may have multiple, you mentioned a team approach. There may be an ENT in the picture. There may be an orthodontist that's airway. You may have a myofunctional therapist involved. There's so many.
So many.
So not to get overwhelmed with all the pieces, it's just like find one person who's willing to like hear you out on your concerns, and then they'll be able to kind of shuttle you in maybe the next place.
Right.
Uh,
Exactly.
because it can be very overwhelming, but
Yeah. And I mean, it is especially for parents who are thinking their child may need braces. They don't know, where do we go? It's there's a plethora of information, which is a good thing, but
right.
also a hard thing for moms.
Yeah, sure.
But like I always say, just listen to your gut,
Hmm.
trust your gut.
Hmm.
Nobody is going to know your child like you do. Nobody,
Absolutely.
nobody.
Well, that leads us into like some valuable tips. You experience mom and orthodontist.
Mhm.
What do parents need to hear to help them
Oh,
maybe take the first step?
take the first step. Yeah. I mean, first of all, just know that it's really easy. The early intervention work that we do is it's all extremely digitized. It's customized to make the process very easy. So, traditionally orthodontists are like, oh, I don't want to get involved with early treatment. But the expander process is very easy. We don't do spacers anymore. If your audience has had braces, likely they may have had spacers. Spacers hurt, and we don't do bands really so much anymore. Those are the rings that fit in between the teeth. We scan the teeth, so we don't need impressions. And then the child comes in, we mix up some glue, and we literally seed it down on the teeth, wipe off the extra glue, shine a light, and that's it. So it's very easy for very young kids to handle. We do a little bit of breath work before the procedure. It helps them reset, get enough oxygen, and they definitely calm down. And once that happens, they're ready to roll, and then they're super proud of themselves. So just know that the journey is the getting started on this new type of treatment is really easy. And we're very accustomed to it now, and we're doing a lot more of it. So our team is wonderful with it, and the kids, and it's just an easy environment. We call ourselves the tooth salon, more than the dentist. And that's sort of really more like what it's like. And if your child is older, we can still do expansion. There's a hazy line between, that varies from patient to patient as far as at what age can we still expand. But it's in the range of, 11 to 14 that we can still widen out the palate and get good airway changes on those kids. Beyond that age, there's still hope. We are starting to do expanders in adults that are bone-born. Super exciting stuff. And it's definitely an alternative to a CPAP. Not a solution, but it can help airway for sure.
Right.
And it's very exciting that it's going to be integrated into our practice on a daily basis. We're beginning those first few cases right now with a multidisciplinary team, and so far it's been super fun.
Exciting.
So those are some tips. Just know that there is a solution. A lot of times parents or adults feel dismissed and like their only option is CPAP or all the different things. But if you get to the root cause, there are other solutions, and it may not involve me.
Right.
It may be just myofunctional therapy.
Right. Yeah, for sure.
The combination of myofunctional therapy and orthodontics to me is like the dream team. But it's not always needed.
Well, and I think that that's encouraging for families who maybe feel like they missed the boat. So you don't have to have guilt that, oh, my kid's now 13 and I missed the boat.
Look, I missed the boat. I'm the parent and the doctor. I missed the boat. But we're doing something about it. We're going to do a bone-born expander. And we're gonna fix it. We're gonna fix it. There are solutions, and she's 17. So there's if this is something you want, there are solutions. Put it that way.
Right. Oftentimes we learn through the most painful points in our lives. So what's something that's stung you? That's
it. Yeah. Oh, definitely. Looking back at my career and what we were trained and what I did and what I saw and missed, all the airway presentations and all the kids that I completely missed it. I completely was oblivious to it, frustrated by it, but didn't understand it. I didn't understand why why they were doing what they were doing, grinding their teeth so much. Like it wasn't a frustration. I just thought it was something we do. I don't know. No one really understood it.
Normal. Like we just,
Just,
it, like babies drool, that
yeah,
like adults snore because they're
yeah,
tired. And,
right.
you must
You,
stress. You need to go do yoga because
yes,
you're crying,
that's it. That's it.
you know?
So that really bothers me. I don't feel good about all that, missing all that, but
It spurs your
all we
passion.
can do
It
is,
spurs your passion for what you're doing now.
yeah, yeah, I really am. I mean, I just love it. It doesn't feel like work at all, and it just feels like helping people get in touch with their true potential. Just totally flower, get rid of all of the factors that are holding them back, and yeah,
Mhm. Yeah.
super fun.
And it's so exciting to be a part of that pendulum swinging from
It is.
told, you do what your doctor tells you, to being on this other side of empowering people to be like, no, there is more. And
There is.
I'm not the crazy mama who's always just trying to make
It's
things.
so fun.
Yeah, it's so
It
beautiful.
feels so right. It feels so organic. It feels so, easy. Like the solution is not hard. And it changes people's lives so much.
Right. Right.
And yeah, so I think you're doing a great job. Thank you for the opportunity to bring awareness because that's the whole key.
No, well,
That's the whole, that's the whole key is that no one knows this is happening.
Mhm.
And I mean, it's the worst seeing kids in braces that are not growing right. That I'm like, oh my gosh,
Right.
very hard to see, very
It,
hard to see.
and it's tough when you're used to looking at faces all the time. I'm sure you can look at people
Oh,
just walking across you in the grocery
oh,
store
absolutely.
and are
I
like,
have to put my reading
oh,
glasses on in mass.
like I just can't do
Uh,
that. Yeah,
diagnose people all day.
all the time. I mean, I'm diagnosed and I'm like, yeah, you probably have an undiagnosed tongue tie, just by the
Yes.
head, their skull, their facial features are. I mean,
Everything.
and that's
Yes.
what's so exciting about bringing all of this to light because
Thank you. It's
it,
it's so fun to be a part of as many disciplines as I can be a part of because that's where I learned this stuff. I mean, we in our study club, I had no idea that scoliosis could be related to this. I had
wow.
no idea. And then when we started talking about it, and I'm like, oh, this makes so much sense. So now I'm referring patients with scoliosis to this physical therapist who I can't wait for our next study club meeting because she's going to present some of those cases and see what's happening.
Wow.
Yeah. And it's very positive.
Yeah. Yeah.
So,
Well, that's
yeah,
awesome.
super fun.
So where can people find you?
Well, we have a website, hamadaorthodontics.com. We've got an Instagram,
Okay.
Facebook, and I think we might have a YouTube, but I'm not real sure.
Sure.
So safest
That's
bet
good.
is Instagram and website. We have a ton of information on there. And yeah, that's
Perfect.
pretty much us.
I can't wait to continue to connect and refer. So I think this is just the beginning of something great. So
Thank you
thank you.
so much. I just love talking about this. So thank you for giving me the opportunity. Ashley, I appreciate it.
Absolutely. Absolutely.
I hope you found this episode on the feeding solutions helpful. If you would like more information, please follow Sensory Solutions on Facebook or Instagram, or you can always visit our website at www.sensorysolutionsTherapy.com. Thanks so much for joining today and look forward to seeing you next time.